So Carol Plum, thank you so much for joining us. Carol, she's the program coordinator. She works for a nonprofit in Philadelphia, but actually their building is very close from NSC. And they're very famous because this nonprofit, you guys offer so many programs, and the best of everything is that they're all free. So today in particular, just gonna be talking about one area they work in is the healthcare options or training programs they have. So well, this is all yours. Thank you so much, Carol.
Okay, thank you. Hi, everybody. Okay.
Please make sure to ask all the questions you guys have for her, okay?
Yeah.
Okay, first, I just want to tell you that I work for an agency that's about, I don't know, 5 or 6 blocks away from Nationality Service Center. It's called District 1199C, and we have about 700 students at any time. We teach almost everything, but one of our big programs is to teach people jobs in healthcare. In Philadelphia, there is a huge need for home health aides, nursing assistants, and nurses. And we have in our agency a school accredited by the state that teaches all of that. This is the name of my agency, District 1199C, and we have healthcare training. This is me, Carol Bloom, and this is where you can reach me to text or call. Now, these are the 3 types of training we have. I'm going to talk to you about this one first. ESL Home Health Aide Training. Now, the reason that this is important is because it's the perfect way to start to learn a healthcare career if you are not a native English speaker. In this program, you learn basic nursing skills, but you also learn medical terminology, medical English to help you learn the nursing skills. My students who have been in the ESL Home Health Aide course, then they go on to nurse aide or licensed practical nurse, and they come back and they tell us, I could not have made it through the nurse aide training if I didn't have the English help in the home health aide class. Now, you can see home health aides don't earn a lot of money. We don't want our students to stop here. We want you to study here, get a good background in the medical English that you need, start working, and then you can be earning some okay money while you continue to study. Most of our students go in to be licensed practical nurses, but they work as nurse aides to help pay for this program. And they work while they go to school part-time to be a nurse. So we try to start everybody, if their English is not at a very high level, we try to start everybody here so that they can get a good base of medical English while they're beginning to study for a healthcare career. So what we hope is that people will go from home health aide with learning English to certified nurse aide, to licensed practical nurse. Now listen, this is 3 months and it's free. This is 3 months and it's usually free. This is 2 whole years because this is like a university degree. And it's part-time. Every other program in Philadelphia is full-time for 1 year. But my students can't go full-time and not work. They need to pay their rent and buy food and everything. So they go, that's why we made our program part-time. It's 2 years, 2 nights a week, and Saturday and Sunday mornings, so that our students can still work while they're studying. Okay, why do we have an ESL home health aide? because lots of places train you to be a home health aide, but we are the only one that teaches you English at the same time. So while you are studying to be a home health aide, you are learning all the medical vocabulary that you need in English. You're also learning and practicing the speaking and listening skills that you need for working with your patients, their families, and your supervisor. And you are practicing the reading and writing you need to write patient notes, to understand the orders that doctors or nurses or your supervisor leaves for you. So all of these are part of the ESL component of the class, all stuff that you need in all healthcare careers. And that is why we do a whole ESL portion of the HHA class. Then by the time you get to your next level, you have a fantastic base in English and don't need to worry about that anymore. Okay, so let's talk about the different training. ESL Home Health Aid is free if you are already taking English at my agency. So before you can start the home health aid, you have to be taking our English classes for at least a few weeks. Certified nurse aid is next. It costs actually $1,600, but most of the time we give you a scholarship and you don't have to pay if you've completed ESL. So far, while I've been at my job, I have not seen a student have to pay to be a CNA. It's possible they could someday, but I haven't seen that yet. And then the licensed practical nurse program, like I said, it's like a university degree. It costs $18,000, but there's financial aid from the government. And also, I don't know if you guys are registered at CareerLink, but you should all register at CareerLink. They will help you with $6,000 towards your education one time. So you have to choose very carefully what you're going to study because they're only going to give you that money one time. Okay, this is where you start depending on your English level. If your English level is already very high, you might be able to go right into certified nurse aid. This program, it was going to start again in April, but of course everything closed because of coronavirus. So now I am hoping that we're going to start a class in July online. So the English and the nursing will be online, but the lab skills like hand washing and taking, blood pressure and all of those nursing lab skills, they will not be taught until later on in the year, like maybe September, when we get back into our building and into our nursing lab. But all of the book content will be taught online.
Okay, Carol, one question. This is Marcela. So,
Yes.
so the ESL classes that they will have to join the ESL classes first in June, and then they will start the HHA classes in July?
That's the idea. They have to be in our classes of English for at least 12 hours before they can go into the ESL home health aid.
But they still have to like apply with you and take exams, right, to see if they get accepted,
right,
into the
but
program.
Of course right now it's a little bit easier to get accepted because we don't have our testing running, and it's mostly going to be sort of an informal assessment.
So how would be the process in case any of them, because I know some of them are interested?
If you are interested, you need to text me or email me. I will send you some questions to answer, and then we will talk on the phone and have an interview. And depending on your English level, I'll either tell you that you need to start here or that you might be able to go right into nurse aid, depends on your level. Many people that I have talked to through Nationality Service Center are at a very high level of English and they can go right in here. But those who are not at that high a level will start here. And that's the first. Now, this is probably, the HHA is probably not going to start until later in July. So you have time to get tested, informally tested by me, and start taking the English classes before the HHA starts, and then just slide right into the HHA class. Any other questions from anybody before I go on?
Are they going to be via Zoom, the ESL and the
Yes.
HHA classes?
It's with Zoom. So the English and the nursing skills from the book will be through Zoom until September, more or less September, when we can get back into our building. We are going to do the lab skills in small groups, with social distancing, 1 day a week in the lab. Any other questions?
The classes are going to be, the ESL is going to be Tuesday, Wednesday, and Thursday?
It's not, okay, so the ESL before home health aid is Tuesday and Thursday, 9 to 12. Then the home health aid, it's gonna, I'm not 100% sure of the days yet, but it's gonna be less hours than this because we're not doing the lab. It'll probably be like maybe 8 to 10 hours a week, but it will be in the afternoons, most likely.
Okay.
But you know, with everything online, we're still figuring everything out. The certified nurse aide usually is 4 days a week from 9 to 4. And then, as I said before, the licensed practical nurse is a 1.5-year class, 2 nights a week and weekend mornings. Now, again, they're changing also a little bit because of the COVID-19, but this is how we normally do things. And we're figuring out everything online right now. So this is, oh wait, I wanted to go back here for a minute. So if you start as a home health aide, our students usually get paid when they get out and they start working, $10 to $13 an hour. That's why we say to them, okay, that's a good place to start, but we don't want you to stop there. As a certified nurse aide, you can work sometimes in hospitals and in rest homes or nursing homes. And there they make $12 to $16 an hour and can usually get benefits. So we like people to go this far, but we really encourage people to continue to licensed practical nurse because you make excellent, excellent money as a nurse. My stepdaughter did licensed practical nurse, and she makes over $30 an hour, and she got to choose what kind of job she wanted because there is so much need. And she decided that she wanted to work with babies, and she goes into people's homes where babies are on respirators, where they have sick babies, and she takes care of those babies every day, and she calls them her babies. And she loves her work. And there is so much need for nurses in the Philadelphia area that when you get to this point of being an actual nurse, you can choose where you want to work and who you want to work with. Certified nurse aide, also huge need, but you don't have as much freedom to choose what you want and you don't make as much money, which is why we want people to get to this level. This level can sustain a family. Your pay can take care of your family here. And what's important for me is that you can do all of this right at my agency, District 1199C Healthcare Training. We have a healthcare institute, and you can do all 3 of these things. And 2.5 years from now, you'll be a nurse and you'll easily be making $35 an hour. And that's what we want. We want people to get to that salary that can support a family. Okay, so here is all of my contact information. You can text me. Oops, oh my goodness. You can text me at the phone number, or you can email me. I don't really like you to call because usually I'm doing a million different things. So if you text, then when I have a minute, I can see the text. So I really encourage you, if you are interested in a healthcare career, we are the place to start, and we give you the kind of support you need. Oh, I forgot to say, in the home health aid class, you get the books, 2 uniforms, a stethoscope, and a blood pressure cuff, everything for free. It's provided by the government because there is so much need for those positions. Does anybody have any questions you'd like me to answer?
My name is Leah Moyi. I have a question.
Okay.
I'm really interested with healthcare career, and because of coronavirus, I don't know, like if we need to start, we need to apply now, like apply now. What we have.
We're going to try to start the class online. So you do need to apply now because we're hoping to start towards the end of July.
Okay.
So if you're interested, get in touch with me as soon as possible after this. Just text me, okay? Or email me.
Okay. Also, for the 3 months for the ESL home healthcare,
Yes.
is full 3 months, or we can work and do the classes, or I don't know if you understand my question. Like, is full 3 months we need to be on the classes?
Yes, you have to go. Okay. That's a really good question. Thank you for asking.
Yeah, that's a good question. Yeah.
You have to go to every single class. So it's 3 months. It will probably be 3 days a week. But if you miss more than 2 classes, we have to kick you out. And let me tell you why. When you get your certificate from our school, it says that you have completed, I don't know, I think it's 85 hours of training. And so if you are not in class to complete those hours, we can't give you that certificate. Do you understand?
Yes.
So that's why, yes, if you sign up and you start, you have to go to every class and you have to finish, or else we have to say bye.
Okay. Okay, I'm understand. So yes, I will contact you. I'm really interested.
Well, also, contact me because we don't even know your English level yet. A lot depends on your English level. You might be able to go right into certified nurse aide, or you might be in the home health aide. We just don't know yet, but that's what we'll do, is we'll help figure out where you are and what you need.
Okay. I was in the 1199C.
Oh, really?
Yes, I did ESL English over there.
Who was your teacher?
Mrs. Judith.
Oh, Judy. Yes. Oh, she's wonderful.
Yes. And I completed my class, my ESL class. So I think you can get my record over there or any information.
Well, yes,
but
I can.
Contact you.
Definitely. I can see your test scores, and that will help me know what program to put you in. Absolutely.
Okay. Thank you so much, Mrs. Carol.
Thank you. I really hope you get in touch.
Okay.
Carol, I do, this is Rizal again. So I do have a couple of questions for you, because there's, we have other clients that they really wanted to join today's class just to listen to you, but they were not able.
I understand.
So I do want to ask those questions on their behalf. So the first one, there's a couple of clients that we have that they qualify for the CNA program. Do you guys have any date confirmed to start the CNA?
I don't know, but again, I can't remember stuff, so email me about it and then I will check and get back to you.
So what should we do is what should we do? Like maybe send you the name
Send
of
me
the
an email
clients.
and just say, these people, put their names, are interested, give me their emails, and I'll figure out who is making that decision and I will send their information to that person.
Okay, that would be
Okay?
great. And the other, yeah,
Because
go
I'm
ahead.
not sure if there's going to be a CNA online. I think there is, but I have to find out for sure. So send me their names and their emails.
Oh, that would be wonderful.
Yeah, and then I'll figure out who's deciding that and who knows, and I'll send it to them.
Yeah, that'd be wonderful. I think we
Okay.
have like two or three clients waiting for the CNA, and there's in one of them she got her HHA certificate with you guys.
Oh, okay. I
Yeah,
know,
yeah,
I know. Who is
yeah.
it? Do you know?
Her name is Faith.
Oh,
Yeah,
yeah.
yes. And now she's
Oh,
ready in terms of
yes. I've
documents.
talked. Oh my gosh. She did
Yeah, she's very
our,
excited. I'm gonna talk to
oh
her
my
tomorrow.
gosh. She did our HHA, but at the
Yeah, she did.
time, but she didn't have her immigration status that
Yeah,
she needs to do this CNA.
but now
And
she does.
yes, she called me when she got it, and I was so happy for her.
Oh, that was great. Well, she's one of them, and she's
Yes,
she's
okay,
very she's very
definitely. I
excited.
want her to take CNA,
Yeah.
definitely. Yes, she's a very good student.
Oh, that's good to hear. That's good to hear.
Yeah, oh, very dedicated. Yes, she did a great
That's
job in
great. That's great to
HHA.
hear.
And it was very sad that she couldn't continue on to
I
CNA, but
know. I
she,
know.
she knew she just had to wait for her immigration papers, and now she's got them. We're all so happy for her.
Oh, by the way, Carol, now that you're talking about that, can you please name what are the documents
Yes.
that they need to have in order to do the HHA, the CNA, the LPN?
Okay. Now, this is very, wait, I'm going to go back to the beginning. Okay. This is very strange, but this is the way it is. Anything with the government is always very strange. To do ESL, home health aid, to study, you do not need to have any immigration papers or a social security number or anything. But to receive the certificate at the end, you do have to have those papers. So for example, we were just talking about Faith, wonderful student. She did not have her immigration papers, but she came in, she did so well in the class. She had some of the highest scores, but she couldn't get her certificate saying that she finished until she had her social security number. So she finished studying, let me think. She finished studying in June, a year ago, June
Yeah,
of
I think
last
it was
year.
last year.
Right.
Yeah, I
But
think that's what she told me then.
she didn't get her social security number until like January or February. So even though she had finished, she couldn't get the certificate until January. But then she got it. She started looking for a job, and now she's going to do certified nurse assistant. So you can do the training, you just can't get the certificate or go on beyond that until you have your immigration papers.
And when you talk about immigration papers, only the social security card.
Social security and ability to work.
Oh, okay, so they're working permit or
Right.
employment card. Okay, and they would also need the you need the social security number, or they need to also show the social
We
security
have to see the
card.
card and make a copy. We
You
have to
need to
see
make a
the
copy.
card and make a copy, and then they also have to have some sort of Pennsylvania identification, like a license or the ID card.
Okay, so it would be three things then. So
Right, because since these are paid for partially by state funding, they need to show their legal residence of Pennsylvania and that they have a social security number and can work. So social security card and some sort of Pennsylvania ID, either a license or the ID card.
and their employment card.
I'm not sure about that. I think they just need to have the social and the ID.
Okay, so probably the employment card, they will need it after
Let
they
me find out. Let me
graduate
find
and
out.
and
But
look for
I
jobs?
remember I only had to make copies of everybody's Pennsylvania ID and their social security card, and that was enough.
Yeah, yeah, that makes sense.
Yeah,
Probably they obviously they're gonna need the employment card once they go outside and
right.
look for jobs, right?
But maybe not just to get, because that was all I needed for them to graduate.
Yeah, it makes sense. So my second question, Carol, is related to the licensed practical nurse, the LPN.
Hmm.
So what would be the best way to apply for that one? There is a client who is interested in that one in particular.
Okay.
So, but his background is not in healthcare.
That's okay. A lot of people go straight into that if they have a high enough level of English and they
So,
can pass
what
the,
would be the best way for him
okay.
to apply
Now the
and
thing,
see if he can if he
this
is
is a
eligible?
very demanding, very difficult class.
Okay.
So they have to take a special test to get into that class, and it's a difficult test. So if they take the test, they have to take the test, which I don't know right now where it's being given or if it's being given. I'd have to find out. Um, they take that test, it's called the TEAS test, and if they don't pass it, we have classes called pre-nursing classes that are just to get people to the level to be able to pass that test. Now, the thing is, I do not know the status of that test right now
Okay.
because of COVID. So what the person should do, they should
Yeah.
go to our website, and on our website, along the top heading, it says LPN school. And they
Okay.
should go there and follow whatever the directions are, because I'm sure they've changed because of quarantine.
Okay. Okay. So that would be the best way
Yeah,
for him.
absolutely, because the LPN school is completely independent from everything else.
Oh, okay. I
Okay,
understand.
so they should go to the website, go to LPN school, and see what the menu there tells them to do.
Okay.
Usually, you cannot even talk to anybody on the phone or by email until you go to what they call an LPN information session. And you
Okay.
sign up right on the website, you pick a day, and it's like a 2-hour program where they talk about the test and the classes and how to pay for it and everything. And they
Okay.
won't even talk to you about it by email or phone until you go to one of those sessions. But I
Oh,
have no idea what they're doing now with the building closed. So they have to go to the website and look,
okay. So that would be the first step for
right?
this
Because
client
it's
in
a
particular.
completely independent program. It doesn't work with any of the, it's all by itself. It's a great program, but it's completely independent.
Okay, okay, okay. So we will search for that information then. So just to clarify, so if we have clients who are interested in joining the HHA or the CNA, we have to contact
Get
you,
in touch with
right?
me.
Okay,
But for the licensed practical nurse, they need to go right to the website, pull down that menu and see what it says to do right now. Because I really don't even know what they're doing. They might just be on hold. I'm not sure.
okay. My last question for you, Carol. I know you answered that question and I know the answer, but the students we have today, they were not in the first info session you did
That's
back in
okay.
March. After they graduate, whether it's from the HHA or the CNA training program, does this 1199C help them in terms of employment?
Okay. When the students finish their certificate, we have agencies that we work with that often come right, well, see, I can't say this now because we're closed, but in the past, we have agencies that come to our building and interview and hire right there on the spot. But even during this coronavirus, we have had agencies emailing us and asking them, asking us, please send this to all of your people who have graduated because we're looking for home health aides or we're looking for certified nurse aides. So even when we're not in the building, we are still helping our students get jobs. So we do that as a very important part of what we do.
Wow, that's amazing.
I know. I mean, I have received at least 3 or 4 emails from different people in the agency saying, "Oh, I just got this email from this agency, and they are desperately need, they desperately need home health aides or certified nurse aides." And I get all of my students' emails and I send it to all of them. So yeah,
Wow, that's great. Which is
we are
also a good sign in terms of employment, right? That
right. The
if they
thing is,
decide to go ahead and start those type of trainings, they will sure have a job.
well, I mean, I can't promise, but I will tell you that we do everything we can to help our students get jobs. I mean, we
That's
bring
great.
people to the building, we write recommendations, I mean, we do everything possible. Oh, I should say, well, again, this is different now with COVID, but usually you have to have a physical at your doctor and fill out a specific form, not just not any form that the doctor gives you. We have a specific form we give you that you have to have a physical and you have to have 2-part tuberculosis test to get in, to even start any of these courses. So before you even start, usually you have to have that. I don't know what we're going to do because most doctors' offices are not open right now except for treating COVID. I mean, I don't even think
yeah,
you can
that's
go.
true.
Yeah, I don't even think you can go to a clinic right now and get a physical. I don't think they're doing that right now.
And that's part of
Yes.
the process
Mhm,
also to get accepted.
mhm,
Usually, yes. Usually that's part of the process to get accepted. I'm going to have to
mhm.
talk to the director and see what we're going to
Okay.
do about that.
Okay.
Did you have
Um,
yes, go ahead.
I have a question, Miss Carol.
Yes.
This is Akosia Bonso. I came to you and took the HHA test, and you told me I am more higher, so I should do the
CNA.
CNA entrance, which I came on the exact date, but you were not at the office. I did it and I passed, and I have been waiting.
Well,
So
I
you
know
can
it's
call me, yeah, to
with
start the C.
everything. That's what I said. I don't know if you were here when I said it, but
No, no,
No,
she wasn't. She just joined the class.
okay. So I don't
yeah.
even know. I don't
Mm-hmm.
know if they're giving the CNA online right now.
Okay.
What I said I would do
Mhm.
is if you email me, I will find out who is running it and I will send your email to that person because
Yeah.
like I'm only just starting, nobody knew when we
Mhm.
closed the office, nobody
Mhm.
knew how long we would be closed.
Mhm.
So for example, I was supposed to start a home health aid class in April. Well,
Mhm.
obviously that didn't happen,
Mhm.
and
Yeah.
and now I'm just starting to put one together online for July. And so I don't know where the certified nurse aid classes, like I don't know where in the process they are. But if you send
Okay.
me an email, I will
Mhm.
find out who's making those decisions and I will forward your email to that person. Yeah,
Yeah.
you did score too high for HHA. That was,
Mhm.
wonderful.
Thank you.
Before you came into the meeting today, I said to everybody that a lot of the people that came from Nationality Service Center
Mhm.
did score too
Mhm.
high for ESL home health aid. So
Yeah.
that's really good.
Yeah.
You skip a whole step.
Y-
So yes,
Um. Mhm.
email me. Do you see my
Mhm.
email up here?
I
Up
have your
here?
card.
Oh,
Yeah.
good. You have my card. Okay, it's on my
Yeah.
card.
Yeah. I have your card. I think I emailed you. I sent you a message. Even the lady who conducted the test was suggesting, and she said my CN the scores was higher, so she was advising me, why don't you go straight to the LPN? But I think I need a job first to,
Oh, I
yeah.
don't know. Okay, listen.
I think what we could do,
Mm-hmm. Mm-hmm.
Carol, is since I work with them and I'm the job coach and I work together with Susan. I think it would be just better if we just send the list of the clients and who wants to join the HSA and
No,
then
CNA.
also for the
Okay, but
CNA.
hang
Yeah.
on a
You know what I'm
second.
saying?
Did
I
you
think that
say
would be better.
Mm-hmm.
that the woman who gave you the test said that you were high enough to go into LPN?
Yeah, she said that, but I need a job first. I can't just, so, I wanted to do the
Oh, so you want to do
CNA.
the CNA so you can
Yeah,
make good money while you're doing the LPN.
the LPN.
Yes,
She said that.
that is what many of our students do.
Yeah,
Because this is only 3 months or sometimes
Yeah.
2 months,
yeah.
they do this first, they get a job, and that helps them pay for, and that's why our LPN class is nights and weekends.
Okay.
So that they can work during the week
Yeah.
and make enough money while they're studying to be LPN.
Yeah.
Absolutely. That's a fantastic
Yeah.
plan. Yes.
Yeah, that's really good.
Yeah, and I have the chest X-ray.
Oh, good. You did that before everything closed.
Yeah, and everything.
Yeah,
already.
right before. I remember.
Yeah, I
Thank
have
God.
everything
Yeah.
ready. Yeah,
It's very difficult now. All the doctors and clinics are closed.
I think the health centers are pretty open.
Really?
Yeah, they are
Okay.
pretty open, and you can make appointment with
But
them.
are they? They're open, but for
Yes.
physicals or just
Physical.
for COVID-19?
They are open, I think, for physicals too. If you want to do it, because I called them about my.
I think I will call some and see. Yeah.
About the at the driver's license physical, and they asked me, since I just had one, I can just drop the.
You were
forms.
lucky. You got it right before everything happened.
Yeah,
that's for sure.
Just a week. Yeah.
You did the testing. You went to the doctor. You got everything done.
Yes,
Good for
I
you.
did.
Good for you.
Yeah. So I just to go back real quick. So the physical, they have to do it after they get accepted into the program.
No,
Whether it's the DNA or
they
the
have to do it. They have to do it to get into the program, because we have to make sure they have a clean physical and a clean tuberculosis test.
But they need to be accepted into that program first, right?
But the thing is that they have to do it with a certain form that we give them. So I would have to email them the form, and they'd have to print it out and take it to the doctor.
Okay.
But just to clarify, they need to be accepted first by you, right?
Well, they need to be placed by a test. So we need to know that they can get into the class, but they can't get into the class after they have the test. We give them the medical form, and they go to the doctor. Like, once we know what class they need to be in by their test, then we give them the medical form and we say, okay, when you get this filled out, then you'll be in the class.
Okay, I understand.
Okay. So first we do the placement testing and the counseling, which class they need to go to. And then if they commit and they say, yes, I want to be in the class, I'm going to go to every single class, I'm going to finish, then we give them the medical form, and then we see if they can get into the class if they are physically well enough.
Perfect.
Okay.
That's great.
Where would they be able to print? I mean, are the libraries open? Because a lot of students don't have computers and don't have printers.
Yeah, that's for sure. But I'm pretty sure for the at least for the NSC clients, we can help them.
Are you open?
No, we're not, but we can help.
How? How would you get them the form?
Well, we can deliver it, and I'm gonna give you an example. Like last Friday, I decided to help one of our clients. She was gonna start in this new job on Monday, and she didn't have shoes. So NSC donated a pair of shoes for her. So I went to her house, drove there, and dropped it off. So what I'm trying to say, we're really if we see that the client is interested, whether it's in a training opportunity or employment, will really help.
Well, I do have another idea. I have an idea too, that if the student makes an appointment at a clinic, I can email the form to the clinic.
Oh, that's a good idea.
And then the clinic can print it out and use it and give it to the student.
That's a good idea.
Yeah.
Okay.
Yes, dear.
Yeah. So in my case, I need the forms from you and my doctor to fill it, even though I did it.
Oh, you did it, but you don't have the form yet.
From you, yeah.
Okay, so
Yeah.
send me an email, or no, you know what? Send me the name of the clinic where you had it done, and
Okay.
your name exactly how you had your name when you had your appointment. Then I will email the clinic and say, well, you have to call them and say you have permission to fill out this form.
Right.
And then I will email them the form and they can fill it out.
Yeah.
Okay.
And okay, a second.
But they won't
question.
do it. They won't do it until you give them your permission.
Sure, I will do that. And
okay.
A second one. When I was reading it, I saw that you accept a GED from any country, right?
Yes.
Yeah. Okay. All right. I have that too.
Good.
So.
Okay. Yeah.
Yeah.
I will check on that again, but I'm pretty sure. Yeah. No, I know. They said it doesn't matter if it's from whatever country, any high school diploma or GED from any country.
Okay. Even though I am in a GED class now at a Temple, I still have the old one because some of them I don't accept it. Some of them accept it. I go to the World program. Yeah.
Right.
At Temple.
Okay.
Okay.
Yeah. Don't worry about that.
All right. Thank you.
So that would be another requirement for the CNA program, Carol?
No. Yes. For CNA, they have to have a high school diploma from anywhere.
Yeah.
From here or from their own country or GED, they have to have a high school diploma.
So they will need to present the diploma and the transcripts, or only the diploma?
I think they just made copies of the diploma, not the transcripts.
Okay.
Mrs. Carol, I have a question. It's Leah again. I would like to ask you if the students can do the both classes during the same year, like if it's possible to do the HHA and after do the CNA during the same year.
Oh my goodness,
yes.
As a matter of fact, for example, last year, I always have a class that starts in April, but of course this year I didn't because of COVID. But the class that is HHA, that is April, May, and June, then they, at the end of July, started CNA. They did one and then the other. So within 6 months, they were earning $15, $16 an hour as CNAs.
Okay.
They did both. They did them in a row very quickly. They were both free for them. And then, they were done. They got their CNA. Yeah, definitely. We want people to do that.
Okay. Thank you so much.
I'm so glad you asked. Yes, that's a good question.
Rokia, do you have a question? I saw that you just raised your hand.
Okay. Good afternoon.
Hi.
My question was, I never went to school. I don't have no degree, and I'm a mother of 4. I'm interested in doing HHA, CNA, or LPN.
Okay.
I'm interested, and I hear that you say if I don't have high degree diploma, I cannot even start it. So
you can no. If you don't have a high school diploma, you can still do the home health aid. Okay. You can't do the CNA, so you would kind of be stuck here. But what you could do is do the home health aid if you score high enough. Do the home health aid. And then while you're working and making money, you could do the GED. And then after you finish your GED, you could continue on the healthcare path.
Oh, okay. So I need to do the
GED
HHA first.
The GED is also free. But I would tell you to do this first, because then you could get a job and be making money, even if it's only 1 or 2 days a week that you work.
Okay.
You could do this and then get a job and be making money while you go on to get your GED.
Okay. And my other question is, so before I even start the HAH, should I need to go to the LPN first? Like,
No.
Should I take the LPN test first, or no, I don't?
This, you just come to me.
Okay then. Thank you so much. And I will try my best. I'm really interested in it to do something.
Good. I mean, this is right here. That is the first step on your healthcare career.
Okay. Thank you so
and
much.
For you, there would be a little step in between here called GED.
Okay.
So you would do home health aid, then GED, then CNA, and then maybe LPN. Who knows how far you can go?
And for me, I don't have Social Security yet. Can I still do it?
Absolutely. Like I said, you can do the home health aid training and you can do the GED training while you're waiting for your social.
Okay then. Thank you so
Could
much.
you clarify before we leave? We're close to 1:30, Carol, but
Oh my goodness.
Yeah, can you clarify again the requirements for the HHA and for the CNA?
Okay. All right. For the home health aid, there are no requirements except the English test. You have to be able to read at a 4th grade level in English. So it's only the English test. That's all we have here. For CNA, you need to have a high school diploma from anywhere and a social security card and a Pennsylvania ID, either license or ID card. And then for the LPN, that's a completely different thing. You have to get in touch with them, but they have a very difficult English test, which is reading. Oh, certified nurse aide is also a test of reading and math. And then licensed practical nurse is even a harder test of reading and math. But if you do not pass the test for CNA or the test for LPN, we have classes that you can take to improve your scores on those tests so that you can get into those programs. For example, my last home health aid class finished in February, okay? We were still in the building. And I had about 5 students who did not score high enough on the math. So I gave a special class just for them, 2 afternoons a week in a computer room working on math, on math problems and math ideas so that they could pass the math test. But of course, that had to stop because of COVID. But you know, we take care of your needs. If you finish ESL HHA and you still need more work to get into CNA, we work with you, or you can take our GED classes. If you need more work to get into the LPN, we have specific classes called pre-nursing classes to get your skills to the level where you can pass the test to get in.
Wow, that's wonderful.
We really want people to get to this level where they have what we call a family sustaining wage, where they can make enough money to support their families. And we do everything we can from here all the way to here to get people into and through the programs.
That's great. Well, Carol, thank you so much. Any of you have additional questions for Carol?
Or if you think of anything later, just write down my email, write down my text phone number, and you know, anytime, go ahead and email me or text me.
That's great. Well, if you guys don't have any more questions for now, so yeah, like she said, you can reach out to her later.
Thank you so much for listening, you guys. I really hope you get in touch because all of this whole career path, there is so much need in Philadelphia that if you get any of these licenses, you will have a job.
Yeah, and we do have a group of clients who are we're really looking forward to this info session, Carol. And then the thunderstorm happened last week.
I'm so sorry about that. I don't know what happened, but
yeah,
you know,
that was crazy.
Any more of these that you have, I am more than happy to come and do this presentation.
Thank you so much. I appreciate it. I really appreciate it. Looking forward to see you in person again, Carol.
I know. Thank you.
Do you guys know when you're coming back to the building?
Everybody, thank you so much for coming today. We don't
You're
know.
welcome. You're welcome.
We don't know when we're going back. Do you?
Oh, you don't know yet? We don't know yet. Yeah, we don't
nobody
know.
knows.
Yeah. Well, thank you so much, everybody. Hope.
Thank you, everybody.
Thank you so much for joining us today.